The Minister of State for Works, Engineer Abubakar Aliyu, recently inspected the Kano-Maiduguri road projects to ascertain the standard and level of work done so far. The minister assured that in no time the federal government will embark work on the Damaturu-Maiduguri road, especially along Jakana and Minok axis, which has become death trap for commuters over time.
There was serious problem of insecurity along that stretch. And the road is handled by that particular stretch from Damaturu to Maiduguri is handled by CCECC, and they have done work up to over 60 kilometers percent. The remaining 40% or thereabout is the section where we are having serious insecurity problem. If you could remember, some time back, the insurgent came and burned their machines and killed some of their workers. So that made them to stop work on that stretch. And when they tried to resume, the military were having some exercise there, of which you are all aware. And they wrote them that they should stay off that very section. And that was the reason they were unable to complete that section. Aside that, we don't have any problem. But we have tried our best together with them and the assistance we get from the military and the Borno state government. We were able now to resume the contractor to work on site. For the past, I think, 2 weeks or 3, he's already on site working. If you go now, you will find him working, trying to finish up that area. And it's the only project along Kano-Maiduguri that is suffering from this problem. So, but inshallah, it will be completed very soon.
More than 100 survivors of gender-based violence have been identified to benefit from dignity kits from the African Youth for Peace Development and Empowerment Foundation. The flag-off of the event, which featured a house-to-house sensitization campaign on COVID-19 risk communication among pregnant and lactating mothers in Damaturu and Potiskum local governments. The initiator of the program, Mariam Ajay, says the donation of the kits would support the affected survivors, noting that the gesture will aid them pending when they would recover from the trauma. Other development partners admonished the beneficiaries to make good use of the opportunity.
The motivation about this is to see how women survivors of gender-based violence can be supported through this intervention. Of course, this is not far from the celebration of the incoming celebration of International Women's Day, which is coming on the 8th of March, and we feel the need because we cannot wait until that time to be able to celebrate women that are supporting other women in the community being negatively impacted by COVID-19. And we feel the need that these survivors should be supported with dignity kits so that they will be able to recover fully. We advise them not to sell these kits given to them. They should utilize it because the organizations see the need that they need those kits, and hence this kit were given to them. So we encourage them not to sell it, but utilize it to support themselves and their families.
We in the health sector, we are working with a number of partners, including civil society organizations, who have extensive reach, and they are connected to the grassroots. So we are supporting them technically, and we are providing them with resources to be able to distribute to those vulnerable people, especially women, children, and orphans in the community. So one of the aim of this program is to ensure that those survivors of gender-based violence and then other vulnerable women have received basic commodities such as hygiene kits to be able to use at home to prevent common illnesses.
For us to even do this distribution is because we realize the situation which they are in and they need this help. The COVID-19 is really taking tolls on the livelihood of people, and so the women are mostly affected. And coupled with the fact they are already affected in GBV cases. So we have appealed to them, and we always recommend that they make good use of it and make sure that they utilize it the way it should be. And if possible, yes, it might be small, but it's enough for them to really take care of their hygiene matters and also extend these services to their close family members, especially the children.
One of the beneficiaries expressed gratitude to the sponsors of the initiative.
We are very happy about the items they distribute to us. It's really amazing. We never knew they can help us in this way. We really appreciate them. We are grateful.
The Yobe state government has sponsored 350 students to undertake remedial programs for easier access to gain admission into the University of Maiduguri, Borno State. Flagging off the event, the State Commissioner for Higher Education, Professor Munkaila Mohammed, said the platform will enable Yobe indigents to secure guaranteed admission at the end of the program. While addressing the students, the Commissioner admonished the beneficiaries to also reciprocate the gesture by taking their studies seriously.
Many people are looking for this opportunity but do not get it. The government of Mebanabuni is so passionate about education. That's why we want to maintain this program. That's why we also renovated this lecture hall. When I came in as Commissioner of Higher Education, when I came to this hall, it was in a sorry state, very deplorable. I said, how can our students come and read or study in this kind of situation? There's a need to renovate this. And immediately, the governor approved the renovation of all your lecture halls. His Excellency, the Executive Governor, also paid for the tuition fees. It's a payback time for you to appreciate the effort of His Excellency, the Executive Governor of Yobe State. And this you can only do by concentrating on your study and come out with flying colors. This is a great opportunity for you to go to University of Maiduguri and to study medicine, pharmacy, engineering, law, accountancy, and all other courses. So the ball now is in your court.
Some of the students applauded Governor May Malabuni for prioritizing education among many other competing demands for state's resources.
We thank him for this program. He gives us this privilege to study about this remedials program. We really thank Governor May Malabuni.
I have nothing to say than to appreciate him more and more and more. There's nothing we can use to repay our governor for this effort on us, except we should thank him and may Allah get him more money. Inshallah, I will work hard and harder and put more effort to become the best student, inshallah.
Officials of the Save 1 Million Lives and other health workers recently paid an advocacy visit to the State Ministry of Information. The leader of the team, Hawa Goni, said the essence of the visit was to further strengthen the existing bond of partnership between health sector and the Information Ministry.
Paid this advocacy visit for partnership in awareness creation and program implementation of the Basic Healthcare Provision Fund. As an overview, the Basic Healthcare Provision Fund is a fund set aside by the federal government and states, and it has been established under Section 11 of the National Health Act of 2014 as the principal funding vehicle for funding the basic minimum health care services to cater for the vulnerable and the poor. The fund serves to increase the fiscal space and overall financing of the health sector to assist Nigeria achieve universal health coverage. The whole aim is to contribute to the attainment of the universal health coverage, as well as reduce the maternal mortality ratios and morbidities. Also, infant mortality ratios and morbidities, as well as under 5 mortality and morbidities. So far, Yobe State government has paid the counterpart funding to support this basic healthcare provision fund.
A group of non-governmental organizations known as PLAN has decided to embark on assisting the state government in constructing additional primary healthcare structures in some identified communities in the state. This was disclosed by the team leader of the PLAN delegation during a brief session at the state's primary healthcare center with the Commissioner for Health, Lawan Ghana. Some healthcare equipment and drugs were also donated to complement the efforts of the state government in healthcare delivery to the rural population.
We have conducted intensive trainings for government officials, whom have also stepped down those trainings on adolescent sexual reproductive health and rights to healthcare providers from those 10 locations. And those healthcare providers at the moment are conducting routine visits to provide healthcare services around their catchment areas. This is ongoing, and we've also supported them periodically with routine drugs to be able to effectively carry out those services at the community level. And apart from that, the project is also supporting in the rehabilitation of the primary healthcare centers in those locations. Out of the 10 locations, we are rehabilitating 8 of those primary healthcare centers, and we are building afresh 2 primary healthcare centers, specifically in Dumsel and in Mary PSC.
In his response, the Commissioner for Health appreciates the gesture by PLAN. He added that the items donated will be judiciously utilized.
Government engages and contracts healthcare personnel, from specialist medical doctors to medical officers down to nurses, midwives, and even community health extension workers, and then post them to the relevant locations that are needed, including the primary healthcare centers. Government further enhanced the capacity of the health training institutions to produce indigenous healthcare workers, because by virtue of the location of the state, as well as the ongoing issues that we are facing in terms of security, we found it difficult to get people to come and work with us. So we got government now empowered its own citizens to study the healthcare. And as such, the Shehu Sule College of Nursing and Midwifery, one, hostel accommodation was increased, and secondly, the number of courses were also increased. From community midwifery that was introduced, and of course each of the community midwives were directly engaged by their local governments even before they start studying, to expansion of the quota for midwives and the nurses. And again, we're about to also commence the community nursing program.